As long as someone is healthy, age is not really an issue. As women get older, they tend to have more medical problems. So it can potentially be problematic if there are medical problems. If there's no medical problems and the woman is healthy, the only way that age affects the pregnancy is by increasing the risk of birth defects and mainly chromosomal abnormalities. Every year that a woman gets older, her eggs get older too, and they're more prone to making mistakes when fertilization and the splitting of the egg and the formation of the eggs occur. So Down syndrome, trisomies, sex chromosome abnormalities are all at more increased risk the older a woman gets. We do prenatal counseling on all women. We have the nuchal translucency test where we measure the thickness of the skin of the baby's neck in the first trimester, at the end of the first trimester, beginning of the second trimester. We do blood testing at that time. We do blood testing again in the second trimester around 18 weeks. And do a level 2 ultrasound. With all of that information put together, we can get a pretty good assessment as to whether or not the baby has any genetic problems. It will give us a numerical risk, and then we would discuss with the family whether or not they wanted to have amniocentesis or have definitive testing to see whether or not the baby did have a chromosomal abnormality. Most people opt not to do amniocentesis because it's invasive. They could miscarry from the amniocentesis. So there's been a big push in the OBGYN field to get non-invasive testings, non-invasive ways to tell that the baby does not have a chromosomal abnormality. And now there's a new test that you can pick up fetal cells in mom's blood and actually do what would be the equivalent of an amniocentesis by drawing mom's blood.